Good evening. My name is V Win, and I will be presenting on physical therapy as a career track. An overview of physical therapy. Physical therapists are certified health professionals who use prescribed exercise, hands on methods, and patient education to assist patients that are currently facing both physical and even internal challenges in their daily lives. Physical therapists accomplish this through evaluating each patient in their case, developing a treatment plan effective to their case, and developing a home exercise plan, as well as using manual treatment techniques to assist the patient in regaining mobility, restoring function, and reducing pain. Oftentimes, physical therapists receive patients may have came from a surgical procedure to which they need a physical therapist to assist them in regaining mobility, restoring the function, and reducing the pain in the area that the body part was worked on. Physical therapists may also receive patients that are from other cases, such as a patient who had recently injured themselves due to a fall, to which the physical therapist helps them strengthen the particular area that made them resort to falling, and to also reduce the pain there and regain the mobility and restoring the function so that they are able to go back and continue doing the daily tasks that they were able to do prior to the impact. The scope of physical therapy. Physical therapists have very important duties. One of their most important duties, of course, as any other health professional, is for the benefit of their patient. It is very important for physical therapists to effectively work with their patient in order to help them recover from their injury or from their case. One way in which a physical therapist does this is through communication. Communication may be one of the most important responsibilities that a physical therapist carries. This communication involves communication between physicians, surgeons, and nurses who were involved within the patient's case. This is important in order for both the physical therapist and that other health professional to understand where that patient is currently at, what the goal for that patient is, and what they must do in order to achieve that goal. Oftentimes, physicians and surgeons must reciprocate that form of communication to sending the physical therapist a procedure in which states what weight bearing limit, for example, the patient may not exceed. Otherwise, it may exacerbate or worsen the area of the body that the patient is seeking therapy for. Communication amongst those health professionals are also important in order for the physical therapist to receive the proper scans, MRIs, x-rays that help the physical therapist visualize and understand exactly what is happening to the patient's body. Communication amongst insurance companies are also very important in that insurance companies are the party that establishes a number of visits that the patient is allowed to have to go see a physical therapist. And also, they establish what type of treatments the patient may undergo through a physical therapist. Communication amongst the family and the patient member, if the family allows for a patient member to be involved in the case, is also very important so that they understand what they must do in order to accomplish their goal outside of the medical setting. Physical therapists are generally found in multiple settings such as hospitals, home health, private practices, gyms, and even strength and conditioning facilities. And some patients or some physical therapists work under travel physical therapy, usually in hospitals or in home health or at gyms and strength and conditioning facilities. Those physical therapists may work under a specific supervisor or a manager. However, while working in a private practice, they may be working under an owner or the manager of that private practice. And if they are travel physical therapists, they work under an agency, and the agency sometimes receives, or even the physical therapist that works with that agency also receives feedback from a specific supervisor or manager from the facility that they are currently at. Requirements in order to become a physical therapist. A physical therapist must go through a doctorate of physical therapy program, which, in order to get into a program, you must complete a 4-year bachelor's degree that pursues the prerequisites that are required per DPT program and observation hours as well. Every program requires different prerequisites and also different types of observation hours, different amounts, and whether the observation hours may be in an outpatient setting, an inpatient setting, or a paid observation hour opportunity or a non paid. And then the Doctorate of Physical Therapy program in itself is a 3-year